Good morning, everybody. So I'm going to speak from a provider perspective. And after listening to Eric's presentation and George's presentation, I feel like we need to learn a lot. So like many of us, we are still as a company, as an individual, as a physician, I'm in a learning stage, and I'm learning every day and continue to learn and seem like we're going to learn for a long time. And but there's one thing which is a common denominator, what we have heard over the last 2 days, that the care is about patient-centric and taking care of the person or the patient, and hopefully in the independence of their home. So I named the topic today Convergence of Human Services and Technologies, because we have heard in many different ways the value added proposition, the outcomes, the focus on sustainability, reimbursement, and how we're going to use the technology as we go forward. So just a word about who we are as a company. Almost Family is a Louisville-based company. We are the fourth largest home care provider in the United States, and we are operating in 14 states. And we take care of about 25 to 30,000 patients in 14 states on any given day through our 250 locations. So we have the opportunity to continue to work on a lot of experiments and pilots and trying to figure out how to improve care while serving these patients, a large population of patients in their home in a provider-based environment. We continue to work on building our strategic relations with the physicians, ACOs, and hospitals, and we do some strategic investments. Like just a couple of years ago, we invested a significant amount of dollars in a ACO management company. Not that we are an ACO provider, but we wanted to learn how ACOs work and how ACOs are helping in reducing the cost and improving the quality of care. So the real question in front of us as providers are that what is telehealth? So telehealth, we heard today, from a very simple approach of just using a phone all the way to smart homes, is a wide range. And we as providers, as users of technology, do not know today what's the best way to use technology to provide the best care with evidence-based medicine and ensure the patient is getting within the framework of reimbursement system. And that's what I call is a learning curve for us. So in the simple form, for the patient perspective, it can be as simple as phone, as simple as joining some sport groups, be online, or being monitored, or monitor your patient in the home for biometrics and symptoms, and go all the way to do video visits, which some states, as you know, allow, others do not allow. So, but one thing is for sure, however and whichever environment we may be in, and we heard over the last 2 days about roles of caregiver, roles of physician, roles of therapist, roles of social workers, different models out there. But if just for a moment we pause and say, let people do what they're trained to do. Let physicians do what they're trained to do, let the social workers do what they're trained to do, and so on and so forth, because we got an excellent workforce. And all the pieces in the workforce, all the people who work are very vital in delivering the care to the patient, all the way from caregiver to the team leader, happen to be physicians in most of the cases. But if we just let them do what they do well, but focus on three things, and I call it 3C strategy, that create a vital link among them with help of communication, coordination, and improving collaboration. So from our organization perspective, we try to focus on that how can we focus on improving communication, coordination, and collaboration among different providers within the company and outside the company, because we deal with thousands and thousands of physicians, payers, and referral sources and families on any given day. The outcome, maze of outcome, is very clear to us. We think that we had to declare within our organization what the outcomes should be. If somebody asks, what's your focus on outcome? And that was a difficult question among our physicians and nurses when we go across the state and say, look like, or the country, that can they say in the same language the definition of outcome. We were very clear about our mission, that, and it's common mission for all the providers, that outcome is to keep the patients in the independence of their home. and reduce emergent care, reduce hospitalization, improve quality of life through ambulation, bathing, transfer, all the functional scores which CMS guides us through. We have to focus on quality of life and increase patient satisfaction. I call it perceived satisfaction. It doesn't matter how good a doctor I am or nurse or physician you are. If patient doesn't perceive that they're getting the best care, it doesn't matter. So perceived patient satisfaction is very important. And at the end of the day, we have to reduce the cost for the total system. So looking at the outcomes this way focuses us in the direction that how can we use the technology of today to improve communication, collaboration, and coordination as we go, which is a central theme of our discussion. So technology does help, and the telehealth impact is on the disease management process, improving patient care, and those outcomes slide we just looked at, and also reduces hospitalization, reduces ER. We all know that. And I think we all know most of the things. We know what outcomes are, and we know we want to get there. The difficult part for all of us is, what is that ideal state? How do we get there? And I'll be honest with you, sitting here for the last 2 days, I learned a lot, and I'm very excited, but I'm more confused because I don't know where to start. There is so much to offer and so much to deliver, which we all want to do. We're very excited, and I think it has been a great sessions and great learning platform. But it goes back to connecting the dots that we have to figure out that as providers, as physicians, nurses, healthcare companies, how do we put it together? And we have to put it together in a value-based proposition with evidence-based medicine, managing cost at the same time. There's no other industry in the market which has to do all the above and still have to be compliant with CMS regulations. So we've happened to be one of those industries which is highly regulated, highly controlled. At the same time, we have the burden of patient satisfaction or the consumer satisfaction. So impact of telehealth is across the board on physicians, on hospitals, and in home health setting as providers and patients. Though I will not go into detail of every single slide, but again, my central theme is again 3C, coordination, collaboration, and communication. And we try to divide that by payer, by physician, that how does the coordination, collaboration, communication impacts the physician. If you ask any doctor in the country that what is the biggest challenge every doctor has? Time. We don't have enough time to document. We don't have enough time left to see the patient and do our rounds and still take care of all the regulations we have to. Yesterday, one of the speakers said, well, in one of the settings, they talk to each other all the time. I think it's a great idea to communicate all the time, but really in practical way, can we really talk all the time? And is the expectation is when my beeper goes off or my text comes now, I have to talk right away. I may be in the middle of seeing a patient or maybe doing a procedure, but I'm supposed to talk. Though managing expectations has become a challenge for healthcare providers in all settings. So can technology help us to improve? Do I really need to talk every time? If I have the option of talking to everybody in my team or talking to the patient, what's my priority? Obviously patient, right? But the expectation is we should be talking all the time. So I'm just using that as an example that technology can help us to improve the communication and coordination of care. Now, it's important to communicate, but it may not be as important to talk all the time, right? That's the example. So as a physician, it can help us in care coordination, collaboration, and communication. Same way, it can help for the hospitals. Hospitals are looking for more and more data. Now it is their C-suite focus, reduce hospitalization, reduce penalties, focus on quality outcomes. So same way, you take the same three things and technology can help. Now you have to work through the environment. It may be as simple as having a secured portal. It may be simple as having an advanced two-way communication. Something better than being on the phone all the time is always going to be helpful, and there's so much technology out there to help us in that. So as a provider, if the focus as a hospital provider, as a physician, or as a nurse, or as a payer, if the focus is to coordinate and collaborate, it can be done better with technology than all the time have to be in-person communication. So just a few slides on, we took a project, we took 600 patients with a primary diagnosis of congestive heart failure and deployed technology with our partners, Medtronics now and Cardiacom, and we wanted to see the impact of telehealth. And we realized that there was no reimbursement from Medicare. And then there's episodic care in home health. And then you have to discharge the patient when the patient is no more homebound. So we made a decision as a company to invest in a 12-month study by going through 500 to 600 patients that we're going to manage them through the process regardless of the reimbursement from Medicare. So that was a significant investment for us to do a pilot in that model. And we took the heart failure, and we had exclusion criteria, which is on the screen. And we took 60 of our branches in the 7 states, and we evaluated 566 patients in total who enrolled over a 60-day period. And then we carried the study for 12 months. And we learned a lot from it. And when we went into it, we thought we know it all. But when we came out of it, we thought we had to learn a lot, because there were so many factors which played the role in the success. Fortunately, we were able to demonstrate outcomes, which outcome everybody's interested in the market has been 30-day hospitalization, rehospitalization, and acute care hospitalization and patient satisfaction. We did focus on that. But our focus was beyond hospitalization, because 30-day hospitalization is a new term now because there's a penalty, but hospitalization has been always there. Who wants to be in the hospital? Nobody, right? But if you have to be, then either it's unnecessary or necessary. Can it avoid it or not avoid it? Those are things we wanted to learn through this. And so we used the telehealth monitoring. We did the post-acute care, post-episodic care calls, we call post-discharge calls. And we looked at the training of the clinicians and created some champions in every market and wanted to see how it will impact the outcome and how it will help us to demonstrate value for these patients. So the metrics we use, 566 patients. This is the division of male, female. We try to take an equal portion of those because we wanted to really publish internally that how this will work for us. And what we found that all-cause readmission rate for patients discharged with heart failure diagnosis, we were able to demonstrate with these patients at 12.6% as compared to the national averages, which we have dealt with about 24%. And 30% after 30 days, and 57% had no readmissions. And then we looked at by age group, and those are the numbers which we identified in our internal study. What we learned is that it's not only technology. The 3C strategy has to be complemented with 3 Ps: people, process, and platform. So if you take technology as a platform, and 3 Cs is your focus: communication, collaboration, and coordination, then you have to look at how do you align your people, the human service side, which are your excellent physicians, nurses, and therapists, and caregivers we deal with. And then processes. You have to have best practices. Because if everybody tries to do their way and there's no standardization, they are not singing from the same page of the same book and the same song, you're going to have different results. And we learned that standardizing the processes, standardizing the platform, and then training your best clinicians with highest level of competency possible on those processes was the key to success as we go forward. So technology became a tool instead of a focus. It really became that we need to have identify right people, hire right, train right, and improve their competency, give them standardized processes, collaborate with them, and then take them in one direction that the best care is possible based on these processes if you communicate, collaborate, and coordinate at every step of the way. We learned that best practices, interdisciplinary approaches, as simple as S-bar methodology, the telehealth use as plugged in between, as you see, patient education guides, because we had to improve patient understanding, their literacy level, we had to coordinate that. Focused clinician training and competency became a recipe for the cake. Because it was not one thing, because many people get very much enamored with technology, or we have a monitor and we'll be able to do better results and we can have more admissions. That's not what it's about. It's about can we have better outcomes with lower cost and ability to improve patient satisfaction and quality of life. So the key features of a successful program, we learned, and we made mistakes on the way as we were doing. And we found that in some cases we were deficient as we were going, and we had to improve on the way. So then obviously when you have a successful program and you have results to show for, and you can, whatever gets measured gets improved, and then it also results in more business because in the market everybody's competing for the same market share so the success could lead to growth. Lessons learned, strong clinical champions needed. It's not about what I know as a chief medical officer of a large company. It's about what my caregivers and therapists and the nurses and the physicians know in every one of the 200 markets we learned, or the 60 markets we championed in. It's about hospital physician integrated delivery system. We had to communicate with the hospitals. Monitoring team communication was important. And on everything, we learned that technology could help. It's not about monitors only. It could be IVR, it could be phone, it could be communication portal. Sharing information was so key to the success. And whoever vendor we choose or you choose, you have to be very careful. They are scalable, and they are also focused on not on the equipment, but on the programmatics of it. Operational planning was very important. So, the more you plan, more you design, the better results we could get. So, and success is different for different people. Success for me was different in the organization than the success for my CFO was, or the success for my payer ACO was, or the success for the hospital was. And you have to look at all the stakeholders, put their successes together, and more important, success for the patient. When you're dealing with an 80-year-old congestive heart failure patient with a level 3 CHF, sometime getting up from the bed and go to the restroom is success. Sometime ability to talk to their daughter is success without aspirating, right? So you have to define success for different stakeholders, different constituencies, and put it all together. And then say, okay, can I make a difference in the system by providing this? More often, we get very much swayed by cost or cool technology, or the payer forms follow funding, and whenever there's a funding of something, we want to go in that direction, and sometimes we are trying to please our payers. We have to do that. But at the same time, we got to please who we work for. Who do we work for? For our patients. So patient-centric, we heard many times, person-centric is going to be so key as we go forward, adopting technology. So innovation in telehealth, ideal state, a lot coming our way. We're going from a telephonic system to mobile flexibility for remote patient monitoring, two-way video options. We're trying and we're playing with all these, and we're learning that we have to keep thinking again and again, stop, think, deliver. The old Joint Commission methodology, plan, check, do, act. We still learn and we do try to do that because every step of the way, we have to balance all the stakeholders. Ensure technology can change and scale. We heard that from the experts over the last 2 days, and that's very important. We're going to see more of e-visits as we go forward, out of necessity or out of payer requirement or shortage of people. We're going to see personal health record, talks about it, EHR, EMRs, more and more. And I'll be honest with you, I'm doing it for 20 years as a physician, as a corporate manager. I still don't know which system is the best system, and all systems are best systems, but none of the system delivers everything, so you have to keep thinking and keep delivering as you go forward. Physicians talking to physicians, so important. I met with a technology vendor just a couple of weeks ago, and their whole model was, you are at a patient bedside or patient's home, or you are in a hospital, how can we connect you to your primary care physician of that patient? I thought that was so valuable. Is it practical to do it? Is it practical to do on everybody? Don't know yet, but technology does exist. Equivalent of Skypes and GoToMeetings and all that can be in a HIPAA environment. I'm not saying anybody should use it yet, but looking at it from those angles is so vital because we know engagement of primary care physician is so important. Department of Health and Human Services in this town has included greater use of technology as one of the Healthy People 2020 objectives, improving health of all Americans. Last slide. Innovation in telehealth ideal state, demonstration of value and quality, just not cost saving. Standardization is so important, so lacking. Everybody has an idea. We need to really work towards a common idea. And the common idea in the country is how we're going to manage our seniors' health, how we're going to manage aging population. We're going to use technology in a common way from common platforms to the extent possible. And then reimbursement has to align. If reimbursement is not there, because we live in the environment of reimbursement, sometimes good ideas fail. So all 3 stars have to align to have the best story as we go forward. We are committed to it, and we'll continue to work together. Thank you.
Thank you, Raj. Now we have Wendy Nilsson from National Institutes of Health, who's going to share with us some of her insights on aging and assistive technology.